Yeah, dear medicos, very good evening. We are having the honor to have Dr. Raju with us, rank 81 from DAMS Kakinada. So, beta, we congrats you on this platform for this awesome achievement.
Thank you, sir. Thank you so much for having me.
And beta, getting this awesome rank in the Central Institute, how you are feeling now?
I'm really feeling excited and happy, sir.
So, I'll be sharing on this platform. You are our foundation student. So, I will be using this platform to share the success story. How was the experience of last 3 years with DAMS family?
At the end of third year, I think I decided to join the satellite classes of DAMS. Um, I understood then the importance of making handwritten notes for myself, and I have, especially in COVID, in final year, I got ample of time so that I could even watch the recorded videos and make very good and neat notes. I used all the free time for doing that, and at the end of final year, I had complete notes of final year, sir. So though in internship I tried to read, but I couldn't really. But at the start of preparation, I was confident enough because of that notes I have made in final year.
So in the final year, beta, you made all the 19 subjects, so you just focus on the final year and third year subjects.
I couldn't make every note, sir, so I just focused on final year subjects only, and importantly understanding the concepts behind them.
And what was the role of those concise notes in your prof examination, beta? Like, I'm going step by step.
I I used that notes for everything, sir, literally everything. Even for if I get some doubt in ward postings, I used to refer to that. Yeah, for even prof exams, I came to that, so that yeah, I got more visual memory of the notes, and I need not do a lot of reading after that.
So you use this word, I made very concise notes of all the 19 subjects. That was possible on the platform of Times, beta. And how that concise notes played the role in your INICET exam with this rank of 81. Role of concise notes.
Yes, sir. Because of that notes, I need not write extra anything except adding new information here and there, and I highlighted important points, and um, that note was really enough for me.
And beta, how many times you revise? Like before giving the exam, I want your honest reply on this platform so that every medico should get this message ki how many times revision required for getting good ranks in Central Institute.
Yes, sir. I apart from studying in final year, I give a first reading like in for 3 or 4 months up to the end of July for all 19 subjects. After that, I revised 3 times, quick revisions, but 3 revisions I have done.
So whether these three revisions that you revise your concise notes, along with that you attempted your MCQs, what was the strategy? Like you attempted in the final year or in the internship, you only attempted the MCQs?
I couldn't really complete in internship, sir. I didn't study well in internship, but only after internship I started studying, and I focused more on previously asked questions and more conceptual questions, and I marked them, and also I marked some volatile topics and points, so that at the end of July I had complete PYQs and volatile points that for me.
And what is the role of basic sciences? Like before that, I will be asking you, how was the paper? How was the last INCT examination? You will take it as moderate or it was on difficult side?
It was only moderate, sir. I didn't feel like there are any high-fi questions or anything.
So many students were saying the paper was exhaustive. Was that time management was the issue in the paper?
For me, I completed like one reading of paper in almost 2 hours 15 minutes. I had 45 minutes really. to review back and think about some of the questions.
Which session you had, beta, morning or evening?
Morning, sir, my session was.
And how many MCQ you attempted?
I attempted 200, sir.
That's great. I always love aggressive students. I always love yeah, if you attempt, why to leave the question when the question, yes, we should.
Yes, sir.
I will be I will be sharing on this platform. Okay, there must be 5 to 10 MCQs where you were not confident. Last 190 plus, I'm talking about beyond 190. What was the strategy for those 5 or 10 MCQs, which were the game changer in your success story?
I mean, like for almost every question, I could like rule out at least one question, one option, sir. So I made an educated guess. That's it. So I thought I would go for it rather than leave it.
So, beta, any special message or any special strategy you followed when you were attempting the MCQs, whether it was GTs or SWT or your main examination?
After every GT, I used to like I used to focus more on time management rather than how many questions I have did correct and wrong. And after the GT, I used to give quick analysis, and I don't used to spend a lot of time on GT analysis and reading.
And coming on the subjects, beta, like out of 19 subjects, if I ask you, okay, what was your plan? Like how you handle the basic sciences on one side, final year subjects on one side, which was more important for your exam preparation? Which played the important role, like in last examination?
Obviously, it's for INICET, it is like basic sciences, sir. In final year, especially in surgery medicine, they ask more of emergency trauma kind of thing. So I focused more on that. Actually, I haven't studied ENT and anesthesia because of the time. I couldn't study in internship, and after that, I thought I had less time and left that completely. Remaining 17 subjects, which I have studied, I revised it well, sir. That was my strategy.
How was the experience of DVT, like DVT concise notes when you got the DVT session? How was the experience?
Yes, sir. Actually, I enjoyed really in DVT. I mean, that was so concise, and once I have studied complete notes, so once basic reading, I could like revise and I could remember many things actually from DVT.
Coming on the level of MCQs, beta, MCQs of GTs on one side, examination hall on the other, where you compare. What was the level of MCQs of GTs and SWTs?
It's like I couldn't really give a lot of GTs, but I felt like it was more or less the same, sir. Like, but the basic understanding of concepts is important at any point of time. If you are like understanding topics and everything and focusing on previously asked questions, you are good to go actually.
Any special message for the students who are preparing for NEET examination like last 2 months? What should be the strategy?
I would say, based on my experience, I would suggest them to give more revisions rather than spending a lot of time on same topic and same subject. And last 10 to 15 days of revision is super important than anything else.
On this platform, beta, any special message for your parents, beta, because of whom you are here?
They played a really very important role, sir. Actually, I stayed at my mom all through my preparation, and she took really good care of me.
That's great, Biren. Convey our regards to her, and we wish you very best of luck. And we are confident in the upcoming years you will be again achieving the great heights. Any special message for the DAMS faculty, Biren?
Yes, sir. I enjoyed like every final year faculty I have attended. I really couldn't make any concise more, notes than that, sir. I really love the DAMS family, and I'm really glad that you are being part of my journey. Thank you so much, sir.
Thank you for all these words. And any special message, like you're using this word concise notes again and again, any special strategy you followed for making the class notes? Any advice you want to share with the juniors?
I would say like attend classes and believe in the teachers what they are saying and follow their notes, and that's it, sir. I didn't make a lot of own notes in my final year. I just followed the notes teachers gave.
Thank you, Beta. Thanks a lot for coming on this platform, and we are proud to have Rank-81 with us on this platform. And which branch, Beta? Which branch you are planning to join now?
Radiology or dermatology, sir. Thank you so much.
That's great, and you will be. I am confident you will be definitely getting these branches. And any plan for the NEET examination? Will you appear for the NEET?
Right now, no, sir.
No, you should. You should prepare for the NEET, Beta. Yes.
Okay.
Not.
Okay,
Not.
sir.
Not interested.
If I get seat, I mean, I can. My plan was always Central Institute, sir. So I'm happy.
That's great, Beta. This attitude should be there. You should be at the end of the day, you should be very happy. Thanks a lot. Very best of luck. And we are very happy to share Rank-81 with us on this platform. And thanks for giving us your honest feedback, Beta. Thank you. Thanks a lot.
Thank you so much, sir. Thank you.